Hello, this is another of the lockdown learning sessions. It's Andy again, and this one is on diabetes. I chose this because it's quite a common disease. A lot of our service users will suffer from diabetes, but it actually has some quite serious problems attached to it. So, what is diabetes? Well, it's an endocrine or metabolic disorder. There are two types, type 1 and type 2. We're going to be focusing on type 2 today. And both really involve the inability to produce insulin for type 1, or the insufficiency of sort of being able to use insulin in type 2. So what is insulin? Well, it's a hormone. It's produced by the pancreas, which is the orange highlighted organ on the graphic there, and that's sort of at the base just behind the stomach. And when the body has food, it breaks down things like sugars, carbohydrates into glucose, and it basically, insulin sort of unlocks the cells so that glucose can get in to be used as fuel for the body. So as I say, with type 1, the body's not really producing insulin, or if it is, it's only producing tiny amounts. So in general, type 1 diabetics will need to inject insulin. Often they're diagnosed in childhood or up to about the age of 40. So today we're going to be looking more at type 2, which is more of a sort of a quiet, sort of creeping disease. So a lot of people won't actually even be aware of the fact they've got type 2 diabetes. So how does it all get going? Well, when we feel tired and hungry, it's easy to reach for those bad carbs, so cakes, biscuits, junk foods. They will then be taken on by the body. The body knows it's got to make insulin. It's got to make quite a lot of insulin for those type of foods because of the glucose. Because the body is then swamped with insulin, the cells resist insulin. They just get absolutely inundated with it and they can't handle it anymore. Because of that, the glucose will then circulate in the bloodstream. The body will try and get rid of that as storing it as fat, so that tends to be around the middle of the body and around the major organs of the body. And because the cells aren't getting the glucose it needs to fuel them, you'll feel tired, you'll feel hungry, and it's easy again to reach for those bad carbs, and the whole thing starts again. So very much a sort of vicious circle. But the more it goes on, the more the body makes higher and higher levels of insulin, and the more the body can't actually sort of handle its own insulin. So at a cellular level, we see normal cells at the top here, and again the insulin is sort of used as a key. It's unlocked them, so the glucose can get into the cell, whatever it is, whether it's a muscle, whether it's part of the brain. The brain uses about 25% of your energy at any one time. Whereas at the bottom, the body's just got so swamped with insulin that half these, or more than half these, receptors aren't now working. So only a tiny bit of the glucose is getting into the cells where it's needed for fuel, and the rest of it is just floating around in the bloodstream where it's going to do damage. So how do we measure the glucose, the sugar in the blood? Well, these days it's by blood glucose meters. So as you can see in the graphic here, someone has pricked their finger with one of the lancets that come with them, got a drop of blood. They're going to put that on the test strip that's poking out of the device there, and then within a few seconds it will give you a reading. So these are quite simple. They're simple to use, certainly. They're very clever bits of kit. Usually fairly accurate, but if you do have a service user, a client who is having quite wild readings, just check the meter hasn't been dropped or something like that. If it has, mainly these meters are given away free by the companies that make them, because they make their money off the prescriptions for the test strips. So it could well be that the meter can be replaced for free, and if they've had it a few years, it's probably worth checking to see if it needs replacing. If it does need replacing, make sure it is with one of the ones that the NHS have approved for the area, because, as I say, they're written on prescription. Some of the test strips are more expensive than others, so only certain ones are approved for use currently. So the blood glucose meters give us very much a snapshot, and they're very, very useful things. So there's really two risks. If someone's blood sugar is too low, they run the risk of having what's called a hypoglycemic attack, low blood sugar. And if that happens, they'll feel wobbly, they could faint, they could pass out, and obviously not a good idea if you're about to drive a car or something like that, so handy to have one of these meters in the car to check before you set off, and if it's low, have a snack so your blood sugar goes up. Equally, if you're sort of at the top of stairs or you're cooking or something like that, you don't want to be passing out. I mean, you don't really want to be passing out at the best of times, but obviously some situations more dangerous than others. So there are these risks. If someone is on their own, they pass out, they have one of these hypo attacks, they obviously then don't wake up to take on more glucose, so the glucose can get lower and lower, their energy gets lower and lower, and they can actually slip into a coma, and they could eventually die of a diabetic coma. The other risk is where the glucose is too high, and we'll come on to that. So as I say, the blood glucose meters give you a snapshot, but you can actually get a longer term view. There's a blood test they do at doctors' surgeries and hospitals called HbA1c, and that looks at glycated hemoglobin. So glycated hemoglobin, this is where the sugar has been circulating in the bloodstream, as we saw on those earlier slides. It will actually bond to red blood cells. Once it's bonded to the red blood cell, that's it, it's stuck, and the red blood cells will last 2 to 3 months in the body. So if you measure how many of these red blood cells have got the sugar stuck to them, you get a good view of how the sort of blood glucose is controlled, and that's a good long-term view of 2 to 3 months. So it can't be cheated, and it gives you long-term trends on whether it's going up or down and what control looks like. And we'll come on to how it also, if you can reduce it, the difference it can make. So the treatment, well, the mainstay is actually diet and exercise for type 2 diabetes. If you catch it early enough, reverse the bad diet, give it quite a restricted diet at first, and up the exercise, you can actually reverse and get rid of type 2 diabetes. That's if it's caught in time. If not, you need to go on to drug therapy. First of those, the mainstay is really metformin. Metformin comes in tablets and been around for years. It works really well. It's quite cheap now because it's quite an old drug. The problem with it tends to be that people get an upset stomach with it, so they tend to not take it if they can. After metformin, they'll add in other drugs, so things like SUs, glitazones, gliptins. Glitazones and gliptins, they help the body to resensitize to its own insulin, and they can really help. The SUs, SU is sulfonylurea, that's why they're called SUs. What they do, they make the pancreas work even harder. They make it produce more insulin. So if the body's only recognizing a percentage, a proportion of insulin, let's give it more insulin so it can recognize more of it. So it's kind of a bit of weird thinking really, but it can help in the short term to get back control. But long term, it does mean that the pancreas gets overworked and eventually the pancreas will stop producing insulin. So when that happens, the only thing left to do is inject insulin. So injecting insulin, the things like the auto-injector pens have made it easier physically, but you've still got to rotate where it's done. It can't be at the same site all the time because it causes scarring of the tissue, hardening of the tissue. And also you've got to calculate the dose of insulin for the level of exercise, the type of food, the amount of food that's going to be had. So again, if you're injecting insulin at 12 o'clock for a 1 o'clock lunch and then something happens, that lunch gets cancelled, someone's blood sugar can go very low. So this is why insulin is the last resort, really. So meds awareness, you'll see a lot of medication for diabetics. Bottom right here we've got metformin tablets. So if we go anti-clockwise, we've then got the Avandia, the rosiglitazone. That's now been withdrawn. You now get pioglitazone. Then we move around, we've got things like the sulfonylureas, we've got long-acting metformin. So metformin you would take maybe once a day or whatever, and then it's a slow release. Then we've got things like the gliptins, we've got the metformin, again, more tablets there, we've got insulin injectors, all sorts of things. Now these are just to control the blood glucose. As I say, it can cause so many problems with diabetes in all sorts of body systems that in all likelihood, in addition to this, you'll see diabetics on blood pressure medications, so all sorts of things that they can have there. Also things like the statins to reduce their cholesterols, and it could be all sorts of painkillers maybe for the nerve pains. So they'll probably be on a lot of meds. So meds awareness, very, very important with diabetics to get the right dosage of the right drugs at the right time. It is a stepwise approach. I do apologise, this is very, very hard to see on the slide, but this is from the NHS North East Essex website, and it really just says there that they start with diet and exercise, then they go to metformin, then they start adding in the other medications as and when needed to try and get control. So it is all about getting that blood glucose under control, both day to day, hour by hour on those blood glucose meters, and in the longer term on the HbA1c. So where do we come in? Well, things like checking that people are sticking to their diet and things as they're told to, but their meds are really, really important, but also their foot health, as I say. So if you do notice anything, make sure it's flagged on the body maps. But when it comes to HbA1c, if we can encourage them to take their meds as prescribed, every 1% reduction in HbA1c reduces diabetic deaths by 21%. So over 1 in 5 deaths can be reduced just by reducing HbA1c. Myocardial infarctions, which is the medical term for a heart attack, they're down by about 1 in 7, 14% reduction there. The microvascular complications of diabetes, so this is the retinopathy, the blindness, problems with the kidneys, problems with the lower limbs and things like that, down by 37%. And going on from that, the amputations, or the deaths arising from those, down by 43%. So diabetes can be controlled, can be controlled well. So our role is to help encourage people to take their meds as prescribed. encourage them to eat healthily and exercise if they can. As I say, keep an eye out for things like problems with the foot, with things even like skin damage. Diabetics don't heal as well. So hope that's been useful for you with a bit of background. And I do apologise that the lockdown learning is a bit obviously one-sided, but hopefully it's been useful for you. So if you've got any feedback, any questions, it would be great to hear from you. And if not, keep doing what you're doing, keep doing all that great work, keep staying safe, and I will see you soon for some proper face-to-face learning. Thanks again.